Welcome back, MRHA listeners, to the Voice of Rural Health podcast. Today, I have two special guests on, Allison and Sabrina, representing Maryland AHEC, and I will allow them both to introduce themselves. Allison, would you like to go first?
Sure. Thank you so much, Jonathan. It's an honor to be here. Allison Robinson. I'm with the University of Maryland School of Medicine, Maryland Area Health Education Center program. I currently serve as the Associate Program Director, and I oversee a program that I'm very excited to discuss today called the AHEC Scholars program, among other hats that I wear for Maryland AHEC.
Thank you, and I look forward to jumping into that conversation here in just a minute. Sabrina, would you like to introduce yourself?
Hi, everyone. My name is Sabrina Stokes. I am a third-year pharmacy student at University of Maryland, Eastern Shore, and I am a second-year AHEC Scholar.
Thank you, Sabrina. And I love the University of Maryland Eastern Shore Pharmacy program. There are a lot of good colleagues that teach that program. And I'll be right into the questions a little bit more about the AHEC Scholars program. Can you elaborate on what that program is, Allison?
Certainly. AHEC Scholars is a national, innovative, interprofessional program that's geared for health profession students. The specific disciplines that we enroll in the Maryland AHEC Scholars program are medical students, dentistry, nurse and BSN, nurse practitioner, pharmacy, physician assistant, graduate psychology, and graduate social work. The program exposes these students to interprofessional didactic education as well as community-based clinical or experiential training in rural and or underserved communities. This training has specific requirements for students, but it's incredibly I think it's an incredibly a wonderful program to kind of really set students apart. And I look forward to delving into some of the benefits a little bit later.
Absolutely. And you mentioned, those underserved rural areas, and there's a lot of those, across the state of Maryland specifically, but across the country. Talking to my colleagues when I was just in DC, there's a lot of medically underserved areas as far as practitioners go, both behavioral health and primary care and pharmacy and dentistry. And so that's fantastic. And I look forward to hearing some of those benefits. Could you maybe elaborate on, what are some of the benefits to the program specifically for the students?
Absolutely. So students will enroll in their second year in their second year prior to graduation, 2 years prior to graduation, they're eligible to enroll, which means that they would complete the program ideally when they're finishing their degree program. When they complete the requirements of the program, which is 40 hours of didactic education each year and 40 hours of clinical or experiential, which if they're already doing that for their degree program, it will count as long as it's in a rural and or underserved area. But each scholar, upon completion, earns a certificate of completion, and that really signifies some additional training in interprofessional education and skills. Additionally, they have the benefit of networking with other individuals in their discipline, but not only locally. Remember, this is a national program, so they will get to interact with scholars throughout the country. Also, this will enhance their clinical or experiential training in these rural and underserved areas that are of great need. We hope that, of course, when they experience it, they will have a desire or passion to return and serve the underserved. Building their resume, we believe that AHEC Scholars really sets a student apart. This is additional training and skills that you can put on your resume, but we also encourage and invite our students and nominate them to participate in local national meetings. The National AHEC organization has a biannual conference, and in 2021, we nominated one of our scholars who had the opportunity to present, and that's certainly a resume builder. We've had scholars to present at the research, the National AHEC research opportunity to share their research at national meetings. And so this is really an opportunity that I want our scholars to think that this really sets them apart and is a part of a community that supports them along their career journey, their educational journey.
Thank you for all that great information. And at the end here, I want to dive into how that application process works for students and how they can join the AHEC Scholars program. But, Sabrina, being an AHEC Scholar yourself, can you tell me, what led you specifically on joining the program?
Yeah, absolutely. So as a student pharmacist, one of the main reasons I decided to join the AHEC program was because I wanted to make an impact in underserved communities, particularly in rural areas where healthcare access can be limited. I knew that by joining AHEC, I would not only have the opportunity to develop my pharmacy skills, but also be part of a broader healthcare team focused on improving patient outcomes. And the interprofessional aspect of AHEC was especially appealing to me. I always believe that in healthcare, it's much more effective when professionals from all different disciplinaries work together, each bringing our own expertise to the table, so to say. And in AHEC, I saw the opportunity to collaborate with other healthcare professionals, which would allow me to not only understand my own role as a pharmacist, but see how it fits in a larger healthcare system. And working as part of these teams would give me the chance to see firsthand how we can all contribute to patient care. Additionally, like the chance to gain clinical experience in rural settings is something that can't be taught in a classroom. And AHEC provided me an opportunity to apply my learning while still addressing these real world challenges.
That's a fantastic answer, and I love how you kind of address the holistic approach to medicine. In today's world of medicine, right? It takes a team, and you mentioned that to serve patients. We had actually just had a conversation here recently with a company that uses pharmacists to help educate primary care providers on drug interactions, and I think that points to better patient care, better patient outcomes. And you're absolutely right. And obviously, someone who also likes hands-on learning, you can't learn everything in the classroom specifically. You have to actually be in the field, be in clinics to gain that experience. And so fantastic answer. And, kind of piggybacking off that experience, can you, tell us maybe one of the most meaningful experiences or, favorite activities or trainings that you've experienced during your time in the program?
Absolutely. So one of my most meaningful experiences that I've had as a student pharmacist in AHEC was I participated in an interprofessional team-based training day. It was a part of an initiative aimed to improving patient care through collaboration with various healthcare disciplinaries. There was pharmacists, PA student, nursing students, and social workers. The activity was centered around kind of like a simulated case study where each team member had a role in contributing to the care plan for a patient with multiple chronic conditions. And as a pharmacist, my role was to review the patient medications, check for potential drug interactions, and suggest adjustments based on the patient's overall health condition. But what really stood out to me that day was how much we all relied on each other. The nurse brought in valuable insights about the patient's daily routine and how the condition affected their quality of life, while the doctor input helped guide treatment goals and decision making. And what I really learned from the experience was how essential it is for healthcare providers to communicate effectively and work together. It's not just about us all doing our jobs individually, but creating a care plan all together that is truly patient-centered is definitely valuable. And the power of interprofessional collaboration is what is when everyone contributes their knowledge and skills, we can deliver a much more effective approach to patient care.
Absolutely. And it boils down to, better patient care and again, better outcomes. Obviously, teamwork is something that, the association has stressed. Good collaboration and good communication is also something that we've always been supportive of. And it looks like the AHEC Scholars program is doing just that for, the students. And before we close, I greatly appreciate the overview of the program and some of your experiences. Can we answer maybe the question of how can folks get involved? How can they apply? How can they join the program if they're interested?
Absolutely. We actually just opened our application cycle for cohort 7. Our application is on the University of Maryland School of Medicine website. This particular URL, if I can just read it off, it's medschool, all one word, .umaryland.edu/MAHEC. MAHEC for Maryland Area Health Education Center, and they can just click on AHEC Scholars. We just literally opened our application cycle, and we have our first dental student that has applied, and we're incredibly excited about that.
That's fantastic. And dental has definitely been something that's been on our radar. Obviously, across the board, there are shortages everywhere with providers, both primary care, behavioral health, again, pharmacy, and dental. And so that's fantastic to see that there's someone from the dental space that has applied for your cohort. And for the listeners, we'll make sure that we link all of the information in the description. Obviously, when we send this out via our newsletter, we'll have the links and descriptions available to you. So if you didn't catch what Allison had said, you most certainly can catch it in the description. Is there anything else that you would like the audience to know about the program, or anything else you'd like to highlight?
The only thing I just like to leave my audience with is for those health profession students who are 2 years from completing their degree, if they're looking for a program to set them apart, if they're in this truly competitive world that we live in for either jobs, fellowships, residencies, or a program that supports them. Our program coordinators support our scholars throughout the entire 2 years, and then we track them to see if they're practicing in Maryland, in our underserved areas, in our rural areas, because that is one of our outcome measures. So again, if you're looking for a program to set you apart, to support you, AHEC Scholars is for you.
Well, thank you so much. Sabrina, is there something you'd like to add?
Yes, please. I would love to piggyback off that. As a student who just went through residency interviews, it definitely did set me apart, and it was a big talking point with RPDs. They had no idea what the program was, and getting the chance to explain it to them, they all found it really interesting, and I definitely have enjoyed my time as a scholar, and the support system is out of the world and highly recommend it to any students.
Awesome. Thank you, Sabrina.
Thank you. And I appreciate that, Sabrina and Allison. And again, I would like to echo everything that you've said tonight. I think that the program is vitally important to not only expose individuals to those rural and underserved communities, but you've mentioned the support from the coordinators, in addition to expanding your resume in this very highly competitive world that we do live in, and especially in the healthcare setting. And so I, again, appreciate everything that both of you are doing from the student aspect and from the program direction aspect of this program. And for listeners, again, please check out the description for all of this wonderful, great information. That will also have contact information for Allison as well. So thank you for listening, and tune in next time to the Voice of Rural Health podcast, hosted by the Maryland Rural Health Association.